September is Blood Cancer Awareness Month, and today is Lymphoma Awareness Day.
Yes, SCRI Oncology Partners say 10% of cancer cases are diagnosed as blood cancers every single year.
Yeah, and there are several types of cancers categorized as blood cancer. So Dr. Hans Lee and Dr. Kris Patel tell us more.
Hi, I'm Dr. Hans Lee. I'm a hematologist and medical oncologist at SCRI Oncology Partners here in Nashville, Tennessee. I'm also the director of multiple myeloma research for the SCRI Research Network.
Hi, I'm Dr. Kris Patel, a hematologist and medical oncologist at SCRI Oncology Partners, and I'm the director of lymphoma research at SCRI. Blood cancers represent a category of lots of different types of cancers, but these are largely cancers of blood-making cells or cells of the immune system. They largely can be thought of in big bucket categories like lymphomas that present in immune tissues or lymph nodes, plasma cell diseases or multiple myeloma, and leukemias are another large category.
Generally speaking, we don't screen broadly for blood cancers. Normally, these types of cancer are picked up through routine blood work due to abnormalities in the blood cell counts, or more advanced presentations, lumps and bumps in the body, night sweats, fevers, significant pain, for instance, in the bones, which can happen particularly in cancers like multiple myeloma. I would say that it's important, though, that the viewers really maintain regular health checkups with their primary care physician. This is how oftentimes blood cancers are picked up. So I tell patients that I see in the clinic that multiple myeloma, for instance, is a very treatable blood cancer, that patients can live a very long time with the diagnosis, with the treatments that we currently have. And so again, this is largely in part due to advancements in research, clinical trials that have led to some of these new treatments.
And similar to what Dr. Lee mentioned, the advancement of new therapies from clinical trials, in particular things like CAR T-cell therapy, bispecific antibodies, have really given us many, many more tools in the toolbox to treat patients. To learn more, visit SCRI Oncology Partners at cancercarescri.com.
Really appreciate them sending this information in, because a lot of times we hear cancer and our minds automatically go to death sentence. But in this day and age, that's not the case. And he talked about how treatable these blood cancers can be too.
Especially if they're caught early.
Right.
And that was really one of the important takeaways, to continue going to get those regular checkups, because that's where they tend to find this, through the blood work.
Yeah, I mean, you generally have your blood work done every year when you have your physical,
Exactly.
and so if they can catch it early that way. But again, as they pointed out, if you're experiencing any of these other symptoms, like, you know, the night sweats or the lumps and stuff, you know, if there's anything weird going on, it doesn't hurt.
Right.
It's probably a good idea just to call the doctor and say, hey, this is what's going on, should it be checked out?
Yeah, might as well take a few tests.
Exactly.
See if anything, you know, shows any sort of alarm.
And then when you do get your blood work, you know, even if nothing's wrong, at least there's a base level. So for years down the road, you have some type of documentation of where you have been to where you're going.
Yeah, yeah.
So it's not always fun for everybody to get their blood taken, but it is a good thing.
Yes. All right, to check other helpful tips and information, just head to newschannel5.com/letmehelp. And if you have a question, email us at letmehelp@newschannel5.com.